At the Kimmel Cancer Center, we have many treatment options for patients with metastatic breast cancer. Our treatments are available for you to ensure that you live the very best life with your cancer as we're keeping your cancer in check. Our experts include medical oncologists, nurses, patient navigators, and many others. We come together to create a roadmap to ensure that we do not only provide you with the best possible treatment, but also manage your symptoms. In addition, many clinical trials are available to you. These are opportunities to take advantage of the latest breakthroughs in cancer therapy.
What makes the Johns Hopkins program so special in terms of taking care of patients living with metastatic breast cancer is that not only do we offer cutting-edge, top-notch therapies, but also that we provide an array of supportive care services to take care of our patients so that we're not only treating the cancer, but we're treating the whole person, allowing the patient to live as well as possible while living with metastatic breast cancer.
When I first came to Sibley and met with Dr. Smith for the first time, I was nervous, but she immediately set me at ease. And by the time I left her office, I was feeling like I had the perfect solution to my problems. That has been confirmed to me a million times over in the past 8 years.
Here at Johns Hopkins, we take a very multidisciplinary approach to managing patients with breast cancer. Radiation can play a lot of different roles in managing any patient who has a diagnosis of breast cancer, but particularly in the scenario of a patient who has metastatic breast cancer, there's a wide range of options, a wide range of approaches that we might take to very short course radiation therapy of only 3 to 5 radiation sessions up to several weeks of treatment, depending on what part of the body we're treating and what the symptom is that we're trying to control. We also have a number of clinical trials that combine radiation therapy with systemic therapy to see if the two can work together to optimize results for patients.
At Johns Hopkins, your pathology will be evaluated by a pathologist with special expertise in breast cancer. When a patient has something that is identified on imaging, a biopsy is done, and we process that tissue and then examine it under a microscope to determine what the problem is.
As a patient navigator, I love getting to know my patients on an intimate level. I get to know their family, their friends, their network, and as I come to each clinic visit and to their appointments, I get to know how I can help. That's part of the best part of being a patient navigator, getting to know how I can help, learning more about people's personal stories, and what is difficult for them about living with metastatic breast cancer.
They helped me gain mental stability through this, through the different support groups that are offered. Specifically for me, it was the stage 4 metastatic group, and women ran the whole gamut of how they look, who they were, where they were in life. So I felt very comfortable, as it was so important because I didn't really know anybody with the disease or how to walk through this or what it would look like. Oh, life, I want to be here. Again, no kids, but I have a 21-year-old niece. So when I was diagnosed, I wanted to see her graduate high school. She did that. I also wanted to turn 40. That happened in the same year. So now I want to turn 45 and I want to see her graduate from college, which college comes before 45. But I set short kind of long-term goals, and I just pray that I get there. But every day I still want to be here.